For us in the past, our therapists were basically doing therapy sessions and then, writing the notes from memory, right? So sometimes it could be days later, after multiple sessions. We were asking our therapists to, turn in their notes 48 hours after a session. And they were, having a hard time, hitting that benchmark. Over the past years, we've tried, different things to help them with notes. One of them that we tried in the past was collaborative documentation. And that's essentially when a therapist is, taking notes during a session. And for something like that, I would really like equate it to, going to a doctor's office, right? We've all gone to the doctor's office. Sometimes you go to the the exam room and a doctor will sit down and kind of look you in the eye and have that conversation about what's going on. And sometimes you get a doctor that comes in the room and jumps behind a computer and starts clicking away on the keyboard, right? There's definitely one of those that's a lot more engaging. And for behavioral health, I think the engagement is definitely more important. And then one of the other things we had tried and we were actually going to try before we found Eleos was Windows dictation. So the idea there was we were going to have our therapists, do a session, and then after the session, to kind of capture what happened, dictate into Windows dictation and where it could kind of transcribe it and put it into some form of text. But for them, they would have to, go back and clean it up, and it would help a little bit because they're right after the session, they're able to kind of get their thoughts down, but it would require a lot of cleanup, to do so.